Hi, welcome to Functional Friday. I'm Dr. Sherry Jacobs. I'm a naturopathic doctor and a certified nutrition specialist. And I'm here with Dr. Shannon Kennedy, internal medicine doctor. Today we want to talk about thyroid treatment. So I think the more conventional approach is if you've got a sluggish thyroid, so thyroid that you put on Synthroid. That's probably the most mainstream recommendation. I know that you prescribe some other types of medications. What are those?
Well, Synthroid is levothyroxine, which is T4, which is the form of the hormone that's produced by the thyroid gland, but it's inactive. In your periphery, your T4 is converted to T3, which is the active form of the thyroid hormone that attaches to your receptors. And so there are formulations of thyroid called leothreonine that can be given in addition to your levothyroxine or Synthroid. That is the T3. It's active. It's short acting and it's given 1 or 2 times a day, and it can give you an immediate boost of thyroid function. And for some people, their problem is not so much that their T4 is not being produced, but that they do not convert to T3, or at the level of the receptor, their T3 receptors on their cells are blocked. That can be due to over treatment with T4 or to chronically high stress levels. And so we use both T4 and T3 in synthetic formulations as well as natural formulations, Thyroid, Armor, or NP Thyroid, that we get from the thyroid gland of animals. And so we use these different formulations to give people a good physiological response to thyroid treatment.
Right, and I think you're usually looking at a clinical response. Obviously, somebody's feeling better and then tracking some of those numbers, right? So you know that you've got the right dosage and the right recommendations.
Absolutely. If someone comes in with symptoms of hypothyroidism and their labs support that they do have hypothyroidism, and we give them thyroid medication and they don't feel better, we really haven't accomplished anything. And so we not only look at the numbers and do they improve, but also is the person feeling better from a treatment standpoint.
Right, great.
Yeah.
I think on our end, we're looking also at nutrients that you might need to support thyroid function, things like iodine and selenium, but also looking at things that might be slowing down thyroid function. So, if people come in all the time and say, I've been diagnosed with hypothyroid, but we always want to ask the question, why? What happened?
Right.
What happened to your thyroid? So there's usually autoimmune component that we test for, but then there's also, cortisol issues, nutrient issues. There's something called RT3, where sometimes the body is actually converting to this sort of storage form of thyroid called reverse T3, and that's related to stress. And we hear the word stress, and it's not always mental emotional stress, but maybe stress on the body. And one of the stresses on the body might be, not eating enough, or over-exercising, under-exercising. There's all kinds of different physiological stresses to the body that can result in some kind of abnormal thyroid function and need for certain repair, dietary repair, lifestyle repair, nutrient repair, and along with the right type of thyroid hormone support.
Absolutely. Yes. It's important to look at them both together.